Good evening and welcome to tonight's show. I'm your host, Alex Trebek. Tonight on the show we have Mr. Steal Your Girl, Steve, and Fritz. Our first contestant today, Mr. Steal Your Girl. Tell me a little something about yourself.
I have 35 felonies, I'm lactose intolerant, and I'm your local milkman.
Great to know. And Steve, how about yourself? Alrighty then. Fritz, how are you today?
I have 6 rabbits.
Okay. What do you do?
I am a dancer.
Let's carry on then. Today's categories are terms, types of diseases, blood flow pathway, risk factors, and preventions. Today's contestant order has been randomly selected. Steve, you have the board first. Okay, we'll start with terms for 100. This is the major organ in the cardiovascular system. Ding! Fritz!
Cranberry.
No.
What is cranberry?
No. The answer was heart. Heart. Next question. Steve? Oop. We'll just go with terms for 200. This is the other name for a coronary artery disease. Ding! Mr. Steal Your Girl.
Grothis.
More specific, please.
What is Grothis?
Close, but no. The correct answer was atherosclerosis. Since it is Steve's turn once again, we will just go with terms for 300. What is discomfort in the chest caused by inadequate blood supply to the heart? Ding! Fritz!
What is mangina?
No! Mr. Steal Your Girl.
What is angina?
Correct.
Terms for 400.
A sac formed by bulging of a blood vessel wall or heart tissue. Ding! Steve! Boop, boop, boop. No! Fritz!
Shaking baby syndrome?
No! Mr. Steal Your Girl.
What is aneurysm? Terms for 500.
What is a term for a slow heart rhythm? Ding! Fritz!
Beaver.
No. Steve! Let's see what he's got to say. No! Mr. Steal Your Girl.
What is larynx?
Nobody. I suck. The answer is bradycardia. Let's just move on to types of disease for 100. This disease causes the arteries to narrow and reduce blood flow to the heart. Fritz, you have the board.
Types of disease for 200.
This is when the heart is unable to provide pump action to maintain blood flow. Ding! Mr. Steal Your Girl.
I'm out of milk.
Nobody cares. Steve, what you got? No! Fritz?
Inner thigh?
No. Once again, the answer is heart failure. You can't buzz in again, Fritz. Fritz, unfortunately, you have the board again.
Yes. Types of disease for 300.
This disease attacks the cardiac muscles. Ding! Mr. Steal Your Girl?
What is AIDS?
No. Fritz?
What is? Yeah, boy, cardiomyopathy.
Correct. Congrats, Fritz. You now have the board.
Types of diseases for 400.
This is the disease that causes an abnormal heart rhythm. Ding! Fritz?
San Diego.
No. Steve? No. Boop. The correct answer was cardiac dysrhythmias. Let's go to a quick commercial break. We'll be right back with more. Welcome back. As we go to our leaderboards, Mr. Steal Your Girl with $1,000, Steve with 0, and Fritz with an all-time Jeopardy record of negative $7,500.03. This is the type of diet that may improve heart outcomes. Ding! Steve, can you go 3 for 3? No.
What is most commonly known as the Mediterranean diet?
Correct. Fritz is right. Well, that's all for this episode. This has been the worst episode ever. You guys all suck. I'm leaving. We are skipping Final Jeopardy. I'm going home to my wife, who, by the way, cheated on me. Thank you. Have you ever felt a squeezing pain in your chest that radiates down into your arm and sometimes even your jaw? Well, do not ignore these symptoms, as they may be a telltale sign of a heart attack.
The #1 cause of death in the world is a heart disease.
Some risk factors include age. If you are 65 years or older, you are at a higher risk of developing heart disease.
Gender plays a role as well. If you are a male, you have a higher chance of getting a heart disease.
As far as a specific heart disease, the largest cause of a stroke is hypertension, which is an elevation in blood pressure, or high blood pressure. High blood pressure can result in atherosclerosis, a hardening of the arteries.
Having type 2 diabetes puts you at a higher risk as well.
And lastly, African Americans and Asians have a genetic disposition of getting a heart disease.
There are also ways to prevent a heart disease, such as
maintaining a low-fat, high-fiber diet and avoiding red meats.
And if you exercise at least 30 minutes per day, you can greatly reduce your risk of a heart disease. Increased activity can increase your HDL cholesterol, which helps you wipe out a major contributor to high blood pressure, LDL cholesterol. With limited LDL cholesterol, your chances of getting atherosclerosis decreases.
My name is Fritz and I approve this message.